All right, y'all. Anatomy test overview. Let's go. One, what is proprioception? It is the body's ability to naturally understand and sense its orientation, relative position of body parts throughout the entire world. So, for example, it's being able to understand you're standing on sand versus a hardwood floor, or lifting one knee up, or if there's someone behind you, and so forth. It's the unconscious awareness of where your body parts are in any one point in time in the location. So it's arms out, arms up. It's understanding that. That is proprioception. What are the four layers of muscle fascia? One, superficial fascia. Two, deep. Three, visceral. And four, parietal. Three, what is the difference between eccentric and concentric muscle actions? Eccentric is the lowering phase when the muscle contraction is accompanied by lengthening the muscle tissue, considered the easier part to some degree. Whereas concentric is going to be contraction. So for a bicep curl, it's the shortening, the lifting, and it's going to be the more challenging part. What are the 6 types of synovial joints? 1, hinge. 2, ball and socket. 3, condyloid. 4, pivot. 5, planar. 6, saddle. Explain one of the joints above in detail. I'm not going to do that right now. Go to the joint portion of your book. All right, next up, what is the difference between hyperflexion and hyperextension? So hyperflexion is the movement of a joint beyond its normal range of motion, often in the direction opposite to its normal bending. Whereas hyperflexion is the excessive bending or flexing of a joint beyond its normal range of motion. So, very different. What is synovial fluid? Clear, viscous substance that keeps the body moving smoothly and surrounds the major joints, the joints in general. Provide one example, at least one example, of agonist and antagonist pairs. So biceps and triceps, for example. Biceps agonist, triceps antagonist work together during elbow flexion and extension. All right. One other option or example, the deltoids, shoulders, and latissimus dorsi, back muscle. The deltoids are the agonists as they abduct the arm, while the latissimus dorsi adducts the arm. Away, together. Abduction, adduction, in. Explain the 2 main branches of your nervous system and how they're different. So you have your central nervous system, which is the brain and the spinal cord, central center of the body. This controls the body's main control center. The peripheral nervous system, PNS, nerves extending throughout the entire body, connect the CNS to the rest of the body and the external environment. Whew, let's keep going. Oh, if you're following along, I'm so sorry. Page 352, 353. Share 3 ways joint misalignments can affect a student's well-being. I put a lot in here. Essentially, pain, discomfort, restricted movement and mobility, muscular imbalances, posture issues, joint degeneration, nerve compression, digestion and circulatory issues, sleep disruption, and mental impact. What is the valgus deformity versus a varus deformity? So you're going to want to think about knees. So valgus, VALGUS, where the joint angles outward, so then knock the knees, where the knees point, where the joint angles outward, so the knees knocked together. Whereas varus is where the joints angle inward, so like bow-leggedness, and the knees are pointed outward. So it's the opposite of what you think. So valgus, joints go outward, but the knees go inward. So if you're thinking about this for yoga, which is important, thinking about chair pose, crescent lunge, side lunge, any of those, if the knee is going in or out, that's what this is talking about. If the knee is going in, that's valgus deformity. If the knee is going out, that's varus deformity, okay? What do we want though? Toes and knees straight forward. All right, what are the 4 important ways to warm up? General, static stretching, specific sport warm up, and then dynamic stretching. So sport warm up would be like sun salutations and so forth. How do you relate the 4 important parts of warming up to yoga specifically? So general warm up can be categorized by comfortable, easy poses. Static stretching is where you're holding the poses longer. Dynamic stretching focusing on mobility through sun salutations or moving in and out of a pose. And finally, specific sport warm up is moving towards those peak poses. What's the difference between flexibility and mobility? Flexibility is about muscle length and the ability to stretch, whereas mobility is about the ability to control movement through the range of motion. They are both crucial and they work together. How long should you hold a stretch for and why? 30 seconds. That's how long it takes the Golgi tendon to send the message to the neurological reflexes, the muscular spindles to receive it and to release the stress and the tension. All right, what are the 4 muscles of the rotator cuff? Supraspinatus, infraspinatus, teres minor, and subscapularis. What is the difference between scapular retraction and protraction? So retraction is the pinching of the shoulder blades back together. Scapular protraction is the pushing of the shoulder blades forward and apart. Retract, protract, okay? What are the 5 muscles of the abdominals? Rectus abdominis, external and internal obliques, transverse abdominis, and pyramidalis. That's that tiny little one I'm pointing right at the top of my abs. What is the difference between local and global core muscles? Local core muscles are responsible for providing stability to the spine and the pelvis, whereas global core muscles are responsible for movement and larger motions of the trunk, like running, walking, stepping through into a crescent lunge, and so forth. So local core muscles, think high plank, chaturangas even, bird dog, warrior 3. Global core muscles, think downward dog to warrior 1, warrior 1 to one leg mountain, and so forth. Oh, what are the 4 chambers of the heart? Remember A before V. The upper chambers are called the left and right atria, A. The lower chambers are the left and right ventricles, V. Moving on. Whew. How does the path of blood flow through the heart? Right returns, left leaves. So those are the 2 important ones for the heart. So the right side chambers collect returning deoxygenated blood from the body through the right atrium and send it to the lungs through the right ventricle. Right returning. The left collects the oxygenated blood from the lungs, the left atrium, and sends it out to the body through the left ventricle, okay? So the left is going to send the oxygenated blood out into the body. The right is receiving the deoxygenated blood. It's a big system. What is the electrical signal that is sometimes called the heart's natural pacemaker, and what does it do? The sinoatrial node, SA, is located at the top of the right atrium. It's an electrical impulse from this natural pacemaker, travels through the muscle fibers of the atria and ventricles, causing them to contract. Is it true that when you're upside down, your blood pressure changes? Yes, you should know this. What is the difference between hypertension and hypo? Hyper, high blood pressure. Hypo, low blood pressure. When there isn't enough force. Hyper, when the force of blood against the artery walls is too strong. Should people with high blood pressure do inversions? Why or why not? No, because it can strain the heart, causing it to work harder, potentially even rupturing blood vessels. It can also lead towards dizziness, lightheadedness, faintness, and so forth. Whew! What is the difference between hormones and glands? Hormones are the chemical messengers that travel through the bloodstream. Remember the Lego blocks, we talked about this. They target cells and organs, influencing their activity. And then glands are specialized organs that produce and secrete hormones. Explain what happens to the diaphragm when you inhale and exhale. During inhalation, the diaphragm contracts and moves down. During exhalation, the diaphragm relaxes and moves up to help expel the air. So as you inhale, the diaphragm moves down. As you exhale, the diaphragm moves up. What is good posture for breathing? Shoulders depressed / down away from the ears, chin parallel to the floor, head slightly back like chin tuck, and torso upright and lengthened. What does homeostasis mean? Internal balance, to maintain a steady internal environment within the body. All right, what are 3 poses that can positively impact the lymphatic system, the lymph nodes, remember? 1, child's pose, cow's cats, suns, inversions, twists, forward folds, and side bends. I named them all. Most of them. What is the most important way yoga can help with the urinary system? Through strengthening the pelvic floor muscles. What's an example of something that can, a yoga pose? Bird dog. That's the number 1. We are wrapping this up. We're on page 355. We're almost done with the anatomy quiz overview. All right, we're already up to 12 minutes. Explain the brain-gut axis and how yoga can help with digestion. So, remember, the brain-gut axis is the connection and relationship between the GI tract and the brain and how they influence each other, especially when it comes to stress, which means stress and mindset can influence digestion, which is why yoga can help improve digestion through 1, physical movement, 2, poses that stretch and compress the digestive system, 3, through reducing stress and creating a stronger mind-body connection. Whew. All right, how would you describe hands-on to a new student? Gentle, safe touch that feels supportive and never harmful. Gentle rubs, usually on your low back. When do you inhale and exhale while performing a core exercise? You inhale to prepare, exhale to contract. So inhale on the easier part, the eccentric, the lengthening. Exhale on the hard part, the contraction, the shortening. What is the difference between scoliosis, kyphosis, and lordosis? So first of all, they're all spinal curvature conditions. Scoliosis involves a sideways curvature of the spine. Kyphosis involves an excessive outward forward curve, typically in the upper back. And then lordosis involves an excessive inward backward curve, typically in the lower back. Kyphosis upper, lordosis lower, scoliosis side to side. Explain what a contraindication is. Any medical or health condition, injury, or limitation that could make a particular pose, class, technique, or activity harmful, risky, or dangerous. These are poses that might need to be limited or avoided due to certain injuries and conditions. Whew. How would you explain the difference between challenging yourself or causing harm? So when students are challenged, they may feel slight discomfort, a little labored breathing, even muscular like soreness from contraction. However, they should not feel sharp, acute, ongoing pain, and they should not feel like they're hyperventilating, lightheaded, or dizzy. And remember, they don't want anything that's loud in their face, red. If you're going on colors, green, easy, yellow, orange is medium, red is too much. And if you're going in terms of sound, green or easy is going to be quieter in the body, medium is going to be medium noise, and then too loud is too much. So there's a few different ways to explain it to people. Share how you would explain, name 3 poses that help open the hips and pelvis for pregnant students. Goddess, Malasana, Warrior 2, Side Lunge, Child's Pose, Frog Pose, and Turtle. Name 3 poses that help strengthen the core for pregnant students, or honestly, for anybody. Bird dog, plank, mountain climber, standing core work like runner's lunge to crescent lunge. Name 3 pregnancy pose alternatives. So instead of child's pose, they could put blocks under their hands. Instead of a forward fold or any prone, instead of forward facing dog or belly back bends prone, they could do camel. And then instead of downward dog, they could do table. But there's so many options out there. Name 3 most important pregnancy contraindications. 1, avoid putting pressure on the abdomen. 2, avoid deep twists. And 3, avoid holding your breath. Name 3 benefits of practicing yoga while pregnant. And I'm going to say this can also be related to just 3 benefits of practicing yoga. 1, reduce stress, anxiety, and depression. 2, reduce pain and discomfort. And 3, encourage deeper connection to the mind and body. And then finally, what are the 2 most important things to remember when it comes to pregnancy? Every pregnancy is different, and the student knows their body better than you do. And once again, you could ask that, what are the 2 most important things to remember for any yoga student? 1, every body is different. 2, and they know their body better than you do. That is the entire anatomy exam gone over in 18 minutes. There is no special word for this. You know what? There is a special word. Let's say hallelujah. Thanks, everybody.